It started as a fashion choice with our freshman orientation project, and now for our campus, it's a symbol of connection, hope, and mental health support. Hi, I'm Dr. Marcy Young from Wichita State University. Really appreciate you choosing to come and listen to our presentation today about collaborating in branded campaigns across campus to support our students' mental health. Today we're going to hear from Dr. Jessica Provines, Dr. Terry Hall, and Thomas Skinner. Over the next half hour, we're going to cover some points that we feel may be helpful to share from our journey in this process. We know NASPA has recently done a training on how you create a branded campaign, and we don't want to have too much overlap. So we're just going to share a little bit about our journey. First, we're going to start off with Dr. Jessica Provines.
Thank you, Dr. Young. Like she said, I'm Dr. Jessica Provines. I serve as the Assistant Vice President of Wellness at Wichita State University within Student Affairs, and I'm also the Director of our Counseling and Prevention Services program. My journey at Wichita State started 22 years ago as a transfer student, and that was a challenging year in my life. I wasn't very connected to campus, and I had lost contact with a lot of my friends from high school, and things in my relationship weren't going so well. And so after we broke up, that's when I experienced, my first depressive episode. And at that time, I didn't know where to get help. I had no idea that counseling services existed for students on campus as a psychology major. So as I continued my journey to becoming a community clinical psychologist and started working as a trainee at CAPS, I made it my mission that every student who came on campus, from the moment they got here, that they would know where they could reach out for help and where they could get mental health services. And so that first started out for me as an outreach coordinator, and I really loved doing a lot of outreach, a lot of tabling, and coming up with different programs and ideas. And then we moved into the GLS grant. We got the GLS Campus Suicide Prevention Grant in 2015, and we had that for 3 years. And that's when our idea started to shift from outreach more to a branded mental health awareness campaign. The Suspenders for Hope really started with our orientation program. We had a psychologist on campus who took his role as the game show host for our Family Feud version to introduce students to CAPS services very seriously, wearing his suspenders and his bow tie. And students started calling him Dr. Suspenders on campus, actually taking pictures of him and his family when they were out in the community and posting them on social media. And we thought, how can we take that local symbol and turn it into something more? And that is when we created the We Support You Suspenders for Hope Mental Health Awareness and Suicide Prevention Program. The Suspenders for Hope are really a symbol. Suspenders, they support your pants. And of course, we wanted students to know that CAPS supports their mental health, but we wanted it to be more than that. We wanted to get our community involved and having, students supporting students and faculty supporting students and staff all supporting each other. And so that really is the symbol behind the Suspenders for Hope, is how can we create communities that are supportive of mental health. The We Support You Suspenders for Hope program is really a multifaceted approach to ending mental health stigma and preventing suicide. We have 4 different prongs. The first one really is the awareness campaign behind the Suspenders for Hope. And we do a lot to make sure that that campaign is seen and recognizable on campus. The second piece of our program is the We Support You Preventing Suicide training. We developed the training after the grant and decided that we would link it with our most successful piece of the grant, which was the awareness campaign. And we've had really good engagement since doing that. So we offer those trainings monthly, and we've actually developed the training into an online, on-demand training that anyone in our campus community can do at any time. The third piece of the program is a mental health advocacy program. We want everyone who goes through the training to become a mental health advocate. We want them to share their own stories, which is the reason why I share my story with you, because it's important for those of us in leadership positions to normalize mental health and be vulnerable and end the stigma by talking about it. The fourth piece of the program is the We Support You Mental Wellness in the Classroom card set. And this really is an easy wellness curriculum that faculty can do without any training. It's a card set. They have 5-minute exercises that they can infuse into their curriculum to help improve students' well-being as well as their connection with their peers. So it might be a 5-minute lecture on how to lead your class in deep belly breathing, or it might be a discussion question to get your class talking about what they're struggling with. So how does our program incorporate the brand and the Suspenders for Hope as our symbol? We do that in lots of ways. Virtually everything that comes out of CAPS is branded, from our website to our print material to the various swag that we have on campus. So I've brought some of that here with me today to show you. This is our brochure. So our brochure even has our symbol on it and all of our contact information for students on how they can reach us. All of our print material, any flyers that we make or posters that we create are also branded. We've expanded our apparel offerings outside of just the shirt we have sweatshirts and hoodies. We also have, bags, and in here there's all kinds of suspender goodies, coasters, hand sanitizer, there's stickers. Really love anything in your campaign that can turn your community into walking billboards for your program. And so stickers are great. We also have magnets that faculty can put on their door frames, and all of us at CAPS have a magnet, on our door frame as well. Of course, we have the pins, and then for a more professional Suspenders for Hope, we have the lapel pins and all of our buttons that really increase our flair on our Suspenders for Hope. And so one of the things that we are planning to do in the spring is to expand this even more with our faculty and staff so they can more intentionally incorporate the We Support You Suspenders for Hope program into their classroom. And with that, I'm going to be presenting to our campus academic resource conference and talking to all of the faculty about how they can become a We Support You mental health advocate as well. And for faculty to become an advocate, what we're going to encourage them to do is to, of course, complete the suicide prevention training program, as well as wear their Suspenders for Hope shirts in the classroom and participate on Suspender Fridays. Our campus loves to have Suspender Fridays where we encourage the entire campus to wear their suspenders, especially on mental health awareness days, and then to talk about their own struggles and be vulnerable with their students to let students know that it's okay to not be okay. We also want this faculty to incorporate the wellness cards into their curriculum and give credit for students completing the suicide prevention program and offer class time as a way to let students complete the We Support You Preventing Suicide training. In addition, we want them to get involved on social media, post their selfies in their suspender shirts and share their hope and recovery stories, and encourage their students to follow us on social media so they can get all of the free wellness tips that we are sharing, especially during these COVID trying times. and encourage students to get involved as well by posting, their selfies in their suspenders. So over time, it grows and it becomes a bigger part of you, and you have lots of advocates that get involved in the movement, really, and feel like they're part of, reducing stigma on our campus. And some other recent exciting things for the We Support You Suspenders for Hope program are that we have recently made efforts to take this program off of campus and into our community. We've worked with our Department of Commercialization on campus to license the brand to other organizations. So if you're interested in, bringing this program and putting all of the years of work that we've put into it into play on your campus, we would love to talk with you about that. But we'd also just gladly help you implement these principles for running an effective brand and mental health awareness campaign on your campus. So feel free to reach out to us if you just want to talk about our journey and what we've done. With our new efforts, there's a new Suspenders for Hope website where folks can take the training, they can order the shirts, and they can learn about how to bring the program to their organization. And we're really excited to be partnering with one of our local hospitals who's going to help us bring the program into the local high schools. It is our vision that someday the Suspenders for Hope become a universal symbol for positive and supportive mental health communities. And so thank you for allowing me to share my experience in developing this program with you today. I really appreciate all the work that you do, and I'm glad to turn it over to my colleagues.
Thank you so much, Dr. Provines. Your work and your passion in this project has really made it something that's been so helpful for all of our students in our community. Next, we're going to hear from Dr. Terry Hall, who helped us take this idea and really expand it.
Thanks, Marcy. Hi, I'm Terry Hall. I'm the Vice President for Student Affairs at Wichita State University, and I'm very happy to be with you today to talk to you about our We Support You initiative. This is a program that comes from our Counseling and Prevention Services Department, and I'm very proud of it, frankly. I think that our We Support You initiative gives, for us here, especially at Wichita State, a language and a symbol for the importance of the support that we offer, not only to students, but to our faculty and staff as well. And really the importance of saying it's okay to not be okay and to ask for help. I know myself this year that even I found myself struggling through the pandemic, and that I found myself, reaching out for some support that I hadn't done previously. And, I think that the We Support You initiative helps reminds us that there are times in our lives that we all need help, and that it's not something to be ashamed of or embarrassed about, but reaching out and being vulnerable really is a sign of strength, not as a sign of weakness. One of the things that I think is important for me to do as the Vice President for Student Affairs is to provide introductions and remove barriers for my staff so that they are able to be successful. And so this past fall, Dr. Jessica Provines and I, Jessica is our Director of our Counseling and Prevention Services Department, but also our Assistant Vice President for Wellness on campus. Jessica and I were able to meet with all of our deans and their faculty at the separate colleges back to school meetings this fall. And we talked about the We Support You initiative, the opportunity that we have in providing training, and also that our training is online, that other folks, anybody could sign up and participate in our training. But we also launched a mental wellness in the classroom initiative that has a deck of cards, I think 30 some cards actually, that have some short mindfulness and well-being activities that faculty can easily incorporate into their classes. When Jessica and I were talking about, this opportunity, we thought we'd get a handful of faculty members who were interested. Well, after our meeting with all the colleges, we have to date well over 200 faculty that have reached out and said they'd like these cards, the mental wellness in the classroom cards, that they could incorporate those into their classrooms. We have over 200, which at Wichita State is about a third of our full-time faculty members. And at the same time, we're also running a study to show the impact. So we have a control group and a non-control group to show the impact of mindfulness and well-being on students and their success and well-being. And so we think we're going to get some good research from this initiative as well. But the bottom line is, I think it's the way that our campus is embracing the We Support You initiative. We've had deans buy shirts for all their faculty. We've had our provost's office bought the We Support You shirts and asked his staff members to take the training as well. So you'll see these shirts and some of the different marketing materials running around all over campus, because as a campus, we've said it's okay to not be okay, and we're here to help you get you through those hard times. It's been a pleasure talking to you today, and I hope you enjoy the rest of the program.
Thank you so much, Dr. Hall. The support of the upper administration in this project has really made such an incredible difference. Now we're going to hear from Thomas Skinner, who has helped us in collecting data about this project and how it is translated into change for our community.
Thanks, Marcy. Like Marcy said, my name is Thomas Skinner. I am a PhD candidate in community psychology here at Wichita State University. And I was brought on to help with some of the data analysis with the hashtag We Support You program. So the two things that have been going on long enough to sort of evaluate in this case are going to be the suicide prevention program that we've done is the first thing. And the second thing is also we did a big marketing survey to kind of see what the awareness of the brand was like and its impacts across campus. The first thing we did was the Preventing Suicide program, the hashtag We Support You suicide prevention training. This was started under the Garrett Lee Smith grant in 2018, and since its inception has reached over 1,000 individuals here on campus. That includes students, faculty, and staff. We've also offered it to a number of organizations within the community. Wichita, if you don't know, is considered the air capital of the world. We have a lot of aircraft companies here. And so one of the presentations that I was happy to be at was with Airbus here in Wichita. And those employees were very receptive because suicide prevention and preventing suicide, having difficult conversations, recognizing those signs, that's not something that just happens on a college campus. It happens everywhere. And so we're happy to offer those trainings in the community and have been lucky enough to do so. So this program was started in 2018 after about a year of presenting and collecting initial feedback in what we might call its formative session. We decided to renovate it. And so in the fall of 2019, we decided to go through and take all the data that we had received from the evaluations of the initial Preventing Suicide program. And what we've done is changed it, and we added more things that people liked, and we took away the things that we thought weren't as necessary. And we had knowledge checks that were part of it. We added more stories because that really resonated with people. And we added more intervening conversation practices because that was something that people thought was really valuable. So we now have an evaluation that uses a pre-test, a post-test, and a 1-month follow-up that each person that goes through our Preventing Suicide program undergoes. And so they take the pre-test, the post-test, and the 1-month follow-up. And so we're starting to collect more and more data so that we can really see the effects of the Preventing Suicide program and to see that it really works. And so the early results indicate that it is really, really useful. It has significant increases in both the knowledge of the facts surrounding suicide and the warning signs. It also has significantly increased the awareness of resources for those that are struggling with suicide. When we asked more qualitative questions, things about what was either your favorite part or really useful, one of the things that people said that kind of caught us by surprise was that the most useful or helpful thing that happened during these trainings was the practicing these intervening conversations. It wasn't the knowledge checks, it wasn't the stories, it was these practicing intervening conversations because they are kind of awkward to have just like they would be in real life. And so, people would have to, during these trainings, partner up with someone and have to have these conversations like, I noticed that you've been very blue lately. Is everything okay? And even into more intense questions like, I noticed that a lot of things are going really poorly in your life. I noticed that you've been showing up late to work and missing a lot of obligations. Have you had any thoughts about ending your life? So those can be really jarring for people, but people thought they were really useful because it kind of helps you to get over the awkwardness that if this was your first time doing that in a real life scenario, I think that people would be really hesitant. So people really were grateful that we practiced those during these training sessions because it helped kind of get over the awkwardness of that. So the other thing that I want to talk about is that marketing survey that we gave to a great number of people across campus, once again, students and faculty and staff. So when we asked, the first question that we started with was about the perception of Wichita State University's care. And so everyone was asked whether or not to rate something on a true or false Likert scale. And they were asked, does Wichita State University care about the mental health of its students? So about 50% said that they strongly agree, which is pretty good. And another 40% somewhat agree. So about 90%, either strongly or somewhat agree that Wichita State University does care about the mental health of its students. Colleges a lot of times, kind of had a reputation about, they're just in it for money, or, they want to help students academically, but not always in other areas of their life. So our results suggest that is changing. And we think in large part due to this We Support You campaign. About 70% of respondents recognize the Suspender t-shirt that I'm wearing, and I think everybody else is wearing as well. And it is true. You walk around campus and you see the t-shirt in a lot of places. You see the logo. This brand awareness has really been promoted of this Suspenders and Suspenders for Hope. About 40% of respondents had definitely heard of the actual marketing campaign. So even though 70% recognize the t-shirt, about 40% of participants actually recognize the campaign. So that means that there is a gap and something we need to work on with regard to making sure that people, not just recognize the brand, but they connect it to what it is. They don't just recognize the symbol. So one of the things that we did too was evaluate to see whether or not recognition of the brand had any effect on that initial question that we asked, which was their perception of whether or not Wichita State University cared about the mental health of its students. And when we did run the statistics, there was a significant difference. The more likely you were to recognize the brand, that basically meant and led to the fact that you would recognize that Wichita State did indeed care about the mental health of its students. There was a significant difference there. And so that's encouraging because what it says is that the brand itself does mean something, and that people who recognize the brand tend to realize that Wichita State does care about the mental health of its students. So we asked too qualitatively, what kinds of things were invoked by the logo, the t-shirt logo with the suspenders and the We Support You, and the most common answer by far was that it invoked a feeling of care and support. And so what we thought that was really appropriate to what we wanted, and that was encouraging to us because we really want this to be a symbol of, everybody is holding each other up here on campus, and it's a community of care and support. And so we were encouraged by those results.
Thank you so much, Thomas, for all of that great information. I just want to take a couple of minutes and talk about some of the lessons that we've learned during this process, especially as we've rolled it out across the campus and tried to figure out the best ways to create buy-in for a branded collaboration across the campus to support students' mental health. The first thing that we noticed is that because we're not talking about just a program, because we're talking about a culture change, we're talking about something much bigger than a single event. It takes time. It takes a lot of time for this to become something that's not just a program or not just a shirt or not just a training, to become something that faculty, students, staff, administration see as a part of the institution. And that ultimately is the goal, is that this branded campaign to support mental health for our community is a part of the institution and not just a program from one department. And that takes time. And it can be frustrating, and it can be hard to try and continue to engage to make that more part of the institution and more part of the culture rather than just a program. So stay with it. Keep going. It will take time, and because it is a culture change and not just a program, it needs the backing of students, staff, faculty, upper administration. It needs to be something that all of them are seeing as part of the institution. So it has to speak to them all. And that requires time to give presentations, to give trainings, to really make the commitment to get it out there. Something else that's important is what we call brand recognition. So that is somebody on your campus can look at what you've put out there and know that it's a part of your program and what that program means. And in order to achieve that, you have to be really consistent in what you're presenting in terms of visual brand standards. So keeping that the same can be at times a bit of a shift. We're used to, with every new event or every new program, we come up with something that looks completely different. And with a branded campaign, you want to try to keep that more consistent so everyone knows where it's coming from and why. And once you have that brand recognition, you can start to make expansions. So we're going to show a couple of examples here of other departments, other programs who are using the We Support You branding, and they're all supporting the same thing, but they're going to look slightly different. But we can tell we're all engaged in the same work. For each department and at each group across campus, they are going to bring something new and something different. And the point isn't that we're all doing the exact same work the exact same way to support mental health. There's not really a lot of help in that if we were all doing the same thing. So because we are a university and because resources are finite, we may be all kind of trying to make sure we get the funding that we need, and we have the staff that we need, that we have the resources that we need to help our students in the ways that we contribute. We want to make sure that every department has their own wins and their own identities within the program. And that is a way that you can all combine together in this branded collaboration and still have your own wins in each department and really contribute as each department and still come together as a campus community to support students' mental health. Something that is absolutely vital to have in order to make these programs successful is a champion, and hopefully not just one. And when I say a champion, what I mean is somebody who is passionate, somebody who believes in the good that can happen and the good that can come from staying the course. Somebody who is willing to go out and to educate and to make this message a consistent part of what they do. The more champions you have, the faster the message spreads. But a champion is definitely something that you have to have in a culture change. And as you have more champions, all of a sudden what you'll find is that this program, this branded collaboration that you've created, there are other people on campus who are going to be out there and giving presentations and talking about it. And it's not just you, it's not just your office anymore. It is part of the community. It is part of your campus. And that's a moment where you get to say, it is part of our institution. We have champions everywhere. I know that the work that we've done here for the past 5 years on the We Support You program, I've had so many people be able to tell me the change it's made in their lives. And I'm so grateful for that. I'm so grateful for that feedback. And we've gotten feedback on ways we can make it better. We want to continue to provide support and help troubleshoot, answer questions for anybody who may be engaging in this process themselves. We know NASPA's done a great training on how to create a branded campaign, so we've tried not to cover too much of that. But if you have any questions, concerns, would like us to just talk more, please feel free to contact us. You can go to suspendersforhope.com, and there's a contact form there. And we would be happy to continue this conversation with anyone who has any questions or concerns or suggestions. We appreciate the work that you do. What you do is so important, and our students and our campus communities are better for it. Thank you.